Hello everyone, today we'll be talking about the Mallampati score. The Mallampati score has been used for many years to identify patients at risk for difficult tracheal intubation. The classification provides a score of 1 to 4 based on the anatomic features of the airway seen when the patient opens his or her mouth and protrudes the tongue. A 2006 study showed that for each 1 unit increase in the Mallampati score, the odds ratio of having OSA, which is obstructive sleep apnea, increases by 2.5. The test comprises a visual assessment of the distance from the tongue base to the roof of the mouth, and therefore the amount of space in which there is to work. A high Mallampati score, which is class 3 or 4, is associated with more difficult intubation as well as a higher incidence of sleep apnea. Technique. The score is assessed by asking the patient in a sitting posture to open his or her mouth and to protrude the tongue as much as possible. The anatomy of the oral cavity is visualized. Specifically, the assessor notes where the base of the uvula, facial pillars, the arches in front and behind the tonsils, and soft palate are visible. Scoring is generally done without phonation. Depending on whether the tongue is maximally protruded and or the patient asked to phonate, the scoring may vary. So modified Mallampati scoring, this is the scoring that we currently use. So it consists of 4 classes. Class 1 is whereby the soft palate, uvula, fauces and pillars are visible. Class 2 soft palate, major part of uvula and fauces are visible. Class 3 soft palate, base of uvula visible. And class 4 is whereby only the hard palate is visible. So this is a diagram showing the pillars, the uvula, the hard palate and the soft palate. So in class 1, you are able to see that there is complete visualization of the soft palate. In class 2, there is complete visualization of the uvula. In class 3, there is visualization of only the base of the uvula. And in class 4, the soft palate is not visible at all. So this is a similar diagram. And before this, as we just mentioned some slides back, that was the modified Mallampati score. The original Mallampati scoring consisted of 3 classes, whereby class 1 was facial pillars, soft palate and uvula could be visualized. In class 2, facial pillars and soft palate could be visualized, but uvula was masked by the base of the tongue. In class 3, only the soft palate was visualized. So what is the clinical significance of the Mallampati scoring? While Mallampati classes 1 and 2 are associated with relatively easy intubation, classes 3 and 4 are associated with increased difficulty. So that's all about the Mallampati scoring system. If you like the video, please like, subscribe. Thank you.